So, from thinking from this planning perspective, we're now going to change perspectives, people. Let's do it. And I am very excited to introduce our next speaker, who we're very fortunate to have with us. It's Dinesh Bhurga, who is the Professor of Mental Health and Cultural Diversity at the Institute of Psychiatry, King's College London. And he's also been the President of the Royal College of Psychiatrists, and he's now President of the World Psychiatric Association, as editor of several journals, does a lot of thinking about psychiatry and the world and the determinants of mental health and mental illness. So I've asked him here with a vague brief to talk about psychiatry and urban design. Thank you very much, Dinesh.
Thanks very much, Leila, and thank you, welcome, and thank you all for being here. It was quite a sort of vague direction from Leila. Can you talk about mental health, urbanization, and public mental health agenda? So when in doubt, start at the beginning. What do we understand by mental health? I think one of the major challenges is that somewhere along the line, as a result of Cartesian mind-body dualism, we decided that mental health is there and physical health is there, and they don't talk to each other. Historically, Descartes created mind-body dualism because the church told him that the body belongs to doctors and soul belongs to the church, and therefore they should not be talking. So as a result, what we have created is such a steep cleavage between physical health and mental health. So that's the first point that you need to bear in mind. The second point really is that there's absolutely, utterly compelling and convincing evidence from several studies around the world that 1 in 4 of us in our adulthood are likely to develop a psychiatric disorder. 3/4 of those psychiatric disorders will start below the age of 24. Half of them will start below the age of 15. And if you compare the rates between rural areas and urban areas, rates in urban areas are massively, impressively high. Now, we can't blame buildings for that. I think there has to be something more than buildings. And it may be the living environment rather than the built environment. But it's also incredibly important to bear in mind that it's not only the rates of psychiatric disorders. I mean, there was a very impressive recent study which looked at insecurity among people living in 23 cities compared to people who were not living in cities, and people who live in cities are much more likely to be insecure. High rates of depression, high rates of anxiety, high rates of social phobia, high rates of addictions in the cities. Now, surely they can't be all due to built environment. There has to be something else that is going on. And when we look at social determinants of mental health, poverty, overcrowding, urbanization, unemployment, poor parenting skills. Now, you could equally argue that, poverty and overcrowding could be a rural phenomenon. So what is it about cities? And there was a fascinating piece of work done by Sir Michael Marmot a few years ago, and I don't know if you came across that, on social determinants of health. If you look at the London tube map, look at the central line. From Liverpool Street going east, for each tube station that you move, and if you're living in that area, your longevity drops by a year at least. So if you're 10 years away from Liverpool Street, 10 stops away from Liverpool Street, you're likely to die 10 years younger. Now, whether it is about pollution, whether it is about road traffic accidents, whether it is about other environmental contaminants, whether it is about simply poverty and not having access to green spaces, not having access to good quality transport, so you can't meet your mates. Is it something else? I think that is a challenge for both clinicians and researchers on the one side, but also urban planners on the other. It's also worth remembering that when we talk about public mental health, that if half of the psychiatric disorders start below the age of 15, we have to invest in schools. We have to invest in parenting skills. And there is a wonderful study which came out about 18 months, 2 years ago, which says that when you look at attachment patterns in childhood, and attachment patterns basically mean that how you attach yourself to the significant person in your life. Could be mother, could be father, could be uncle, could be teacher. There are different kinds of attachments. There is secure attachment, there is insecure attachment, there is avoidant attachment. And what this study showed, that those attachment patterns affect your brain structures, not brain functioning, brain structures. So if that is what is happening as a result of overcrowding, poor parenting skills, whatever, and your brain structures are changing, which are going to change your brain function, then you have a very difficult life to lead. So what we ought to be looking at is not only the issues about parenting skills and where children are parented, but also what happens in schools. And there have been some fascinating work done around the globe where teaching children how to cope with bullying, on how to identify stress, on how to identify epilepsy, on how to identify psychosis in villages, has created public mental health programs which have been absolutely stunning. I think the last thing that I want to leave you with is that mental health is far too important to be left to experts. We are all experts. I think it's absolutely critical that we look after our own mental health in the living environment, with safe spaces, with green spaces, with good transport, with lots of social interaction and lots of social support. So I hope this is the beginning of a journey that urban planning, architects, and all of us can work together, look at improving not only our mental health, but also that of the next generation. Thank you all very much for being here.